Good evening, wherever you are. This is Alina Park from ConferenceHype. Our segment will focus on large-scale whole genome sequencing, reveals the landscape and health implications of de novo mutations. From the 2026 July 28 edition of Nature Medicine. Background: depression is a major contributor to the global burden of diseases with substantial socioeconomic consequences. Methods here: to estimate the economic effects of depression, we developed a macroeconomic model using data from the World Bank and Global Burden of Disease Study 2021. Results: the model estimated the impact of depression on labor force participation, educational attainment and work experience, adjusted for age and sex. Discussion: reducing the health burden of depression could yield economic returns by supporting productivity and capital accumulation. From the 2026 July 28 edition of Nature Medicine. Background: fibromyalgia is a common and debilitating chronic pain syndrome of poorly understood etiology. Methods: here we conduct a multi-ancestry genome-wide association study meta-analysis across 2,563,755 individuals from 11 cohorts, identifying 26 risk loci for fibromyalgia. Results: the strongest association was with a coding variant in HTT, the causal gene for Huntington's disease. Discussion: this study provides robust genetic evidence defining fibromyalgia as a central nervous system disorder, thereby establishing a biological framework for its complex pathophysiology and extensive clinical comorbidities. From the 2026 August 3 edition of Nature Medicine. Background: antibody-drug conjugates composed of a monoclonal antibody linked to a payload were designed to deliver high concentrations of cytotoxic agents to cancer cells. Methods: since their inception, a deeper understanding of the mechanisms of action and resistance to ADCs in patients has generated a wealth of advances in the chemistry of ADC constructs, together with rational therapeutic combinations. Results: in addition, the development of multidimensional molecular tools to predict ADC sensitivity, together with the optimal use of new ADCs in early-stage cancers, should contribute to improved outcomes for patients. Discussion: we discuss these opportunities and challenges and predict that in the longer term, the development of diversified ADC libraries incorporating distinct constructs and drug-to-antibody ratios will enable personalized treatment strategies aligned with individual tumor biology. From the 2026 August 4 edition of Nature Medicine. Background: artificial intelligence is increasingly permeating healthcare, from serving as a physician assistant to powering consumer applications. Methods: the opacity of AI algorithms makes the ability of humans to interact with AI algorithms challenging. Results: with fairness-constrained model training, assistance from an AI model that achieved balanced performance across skin tones, improved final diagnostic accuracy, and reduced skin tone-related performance disparities among both lay people and PCPs. Discussion: these findings highlight XAI's varying impacts based on human expertise and the timing of when the AI-based prediction is provided, underscoring the concept that LLMs can act as a double-edged sword in medical AI and informing future human-AI collaborative system design. From the 2026 August 6 edition of Nature Medicine. Background: recurrent glioblastoma is a leading brain malignancy with few therapeutic options. Methods: here we present the complete results of a Phase 1 trial investigating the safety and efficacy of autologous B7H3 targeting chimeric antigen receptor T-cell therapy for the treatment of RGBM. Results: the 12-month overall survival rate was 66.7%, and median OS was 19.1 months from first infusion. Discussion: clinical trials. Gov registration, NCT 05241392. From the 2026 July 28 edition of Nature Medicine. Background: Group B streptococcus disease is a major cause of infant morbidity and mortality. Methods: Stage 2 maternal dose-finding data were reported previously and are not presented here. Results: this Phase 1-2 trial evaluated an investigational maternal hexavalent polysaccharide protein conjugate (GBS) vaccine in non-pregnant females and pregnant participants and their infants. Discussion: clinical trials. Gov identifier NCT 03765073. From the 2026 July 28 edition of Nature Medicine. Background: combining multidisciplinary care plans into integrated care pathways is scalable, generalizable, and effective for several long-term conditions, but not evaluated in long COVID. Methods: our Phase 3 cluster randomized multi-center clinical trial investigated the effectiveness of ICP interventions for LC. Results: compared with usual care, effects on 12-week FAS were -0.18 with multi-organ MRI, -0.53 with digital rehabilitation, and -0.17 with their interaction. Discussion: ISRCTN identifier, ISRCTN 10665760. ConferenceHype is interactive AI commentary only. It is not reporting, journalism, medical education, clinical guidance, scientific validation, legal advice, or financial advice. ConferenceHype is independent and is not affiliated with conference organizers, presenters, sponsors, or exhibitors. From the 2026 August 5 edition of Nature Medicine. Background: nightmares are a hallmark of post-traumatic stress disorder, yet pharmacological treatments remain limited. Methods: here we conducted a multi-center, double-blind, randomized, placebo-controlled trial to evaluate the efficacy and safety of dronabinol for PTSD-related nightmares. Results: at week 10, reduction in CAPS-IV-B2 scores was significantly greater with dronabinol than with placebo, between group difference -1.5, 95% confidence interval -2.28 to -0.71, Cohen's d equals 0.65, p 0.001. Discussion: clinical trials. Gov. NCT 04448808. From the 2026 August 6 edition of Nature Medicine. Background: psilocybin-assisted therapy may be a promising new treatment for treatment-resistant depression. Methods: we examined the feasibility of administering a single 25 mg dose of psilocybin or placebo with psychological support in a randomized controlled trial design with 6 weeks of follow-up. Results: the adjusted between-group difference at week 3 on the MADRS was -10.41, favoring psilocybin, which was sustained at week 6. Discussion: uterus CT number 2018-00357397. From the 2026 August 7 edition of Nature Medicine. Background: millions of users turn to consumer artificial intelligence chatbots to discuss emotional, behavioral, and mental health concerns, creating an urgent need for rigorous and scalable safety evaluations. Methods: here we introduce simulated vulnerability amplifying interaction loops, a clinically validated framework for auditing chatbot behavior in mental health contexts. Results: SimVeil simulates users with specific psychiatric vulnerabilities and conversational intents, engages them in multi-turn conversations with frontier artificial intelligence chatbots, and scores each exchange across 13 clinically grounded risk dimensions. Discussion: SimVeil provides a scalable framework for mapping mental health risk across users, chatbots, and conversational trajectories, offering a foundation for targeted safety improvements. From the 2026 July 27 edition of Nature Medicine. Background: the study of presymptomatic amyotrophic lateral sclerosis and the design of disease prevention trials are greatly hampered by our inability to predict which unaffected carriers of ELS-associated pathogenic variants will phenoconvert to clinically manifest disease, and when. Methods in this longitudinal OLINK explore high-throughput, protomic study, 516 serially collected plasma samples from 33 phenoconverters, 35 patients with ALS, 10 presymptomatic pathogenic variant carriers, and 59 controls were included. Results: here we identified 92 proteins with concentrations that changed before phenoconversion, characterized the longitudinal trajectory of these proteins, and identified a core panel of 19 proteins, which collectively predicted phenoconversion over the 0.5-year to 5-year time horizons, and yielded estimates of time to phenoconversion with a mean absolute error of 1.6 years. Discussion, moreover, our identification of a panel of new susceptibility risk biomarkers based on empirical longitudinal data furthers the ultimate goal of ALS prevention. That's it for now for ConferenceHype's coverage of the July 2026 issue of Nature Medicine. If anything was missed, tell us which article deserves follow-up. Tag us on X. Add your perspective in the comments, share this review with your clinical team, like the video, and subscribe with notifications turned on for the next journal broadcast.